Good evening, everyone. I'm Ramani Sundaram. I'm the Executive Director at Dementia India Alliance. I think I'm the only one standing between the end of the day. It's the last speaker. I'm going to keep it really tight. I know that we are running out of time. I think till now, everyone spoke about how important cognitive screening is, how important longevity is, why it is important to talk about dementia, and so on and so forth. I represent the voice of people who are really going through this condition, family caregivers who are looking after people who are having dementia. So, what is it like when you have a little bit of awareness, when you know cognitive health is important, very, very minor detection of dementia, and people really don't know what it is like to have someone with dementia at home, where to go for care, what do you do when you have only awareness but no action? So, when we talk about aging, this whole conference is talking about longevity. It's been talked about, how do you age well? How do you take care of your cognitive health? How do you take care of your physical health? But what is the data telling us? We are going to be an aging population. And with age comes the risk of neurodegenerative conditions such as dementia. And right now, we are talking about the last study that we have is the Lassie DAD, which came up in 2019, which said that there are 8.8 million people with dementia in India, that is 88 lakhs. And this given that only 10% of people ever receive a diagnosis. So, just before me, Isaac spoke about cognitive screening, how after the age of 45, people should get cognitive screening done for their wellness and stuff like that. Unfortunately, Dementia India Alliance, runs a free memory screening platform called Dem Clinic. Okay, it's a free online memory screening platform which we have been going around telling people, go get yourself screened. You can do it online. There is no stigma. Whenever we go to the community, give a talk on dementia, and I will ask the elderly person, go and get yourself screened. One of the person actually told me, if I get out of my house and my neighbor asks me, where are you going? If I tell him I'm going to my endocrinologist, he's fine. And one day I open my door and he asks, where are you going? And I say, I go to my psychiatrist. He will give me another look. And there are going to be whispers around the apartment. So that's the kind of stigma that is there in an educated crowd. Think about going semi-urban, rural. We don't even know how it feels like. So when we have a free platform for memory screening, still it's a struggle to get people to log on to the platform and get memory screening done. We're even talking about people who have identified memory problems. It is challenging, right? So it is an epidemic. We know there are 8.8 million people with dementia. We know by 2036 there are going to be 17 million people with dementia. We know it's an expensive condition. Okay, I have had about 12 years experience with Nightingale's Medical Trust, which runs residential care, daycare centers for persons with dementia. Whenever we identify somebody or diagnose somebody with dementia, one of the things that we have to prepare them is for the cost that's going to come to their face, right? Many times when they go to a memory clinic, they go to a psychiatrist, they go to a neurologist, they get a diagnosis that your father or your mother is going to have dementia. And they Google what it is like, what's going to happen. That information is not enough. We are talking about people who are going to lose their memory and going to live anywhere between 3 to 12 years with this condition. Think about a middle class household where the father has dementia, he has to be on a diaper, an adult diaper. You get it, say, about 45 rupees into 4 diapers a day for 30 days for about 8 years, only for diaper we are talking about. Other than that, a person leaving their job, sitting at home, caring for somebody, medical expenses, what happens when they become bedridden, what happens when they have longitudinal palliative care, where do you get the money? Right now, it's all out of pocket expenses. There's no insurance that's going to cover all this. Yes, Mental Health Act says that you should put physical health as par with mental health. Both of them, insurance should give coverage at both the places. But in terms of awareness, we are still very, very much behind. So when we look at the cost of dementia, it's huge. The human cost is immeasurable. Spouses who are looking after their loved one with dementia, children who have lost their job, marriages have broken. It is a emotionally, physically, financially toiling condition. what are the challenges that are there right now? In the longevity conference, we are talking about, mitochondrial dysfunction, or, what happens when amyloid beta is not functioning properly and things like that. When we look at dementia on the ground, it is a very, very challenging condition to tackle as an organization who wants to do something for dementia care in the community. There's absolute lack of awareness about what this condition actually means. Today, if we go out to the community, talk to the elderly people, memory loss is not taken seriously at all. So when we go and give a talk in the community, I always refrain from saying dementia starts with memory loss, because there are jokes in the room. People say, oh, I forget my keys, oh, last day I forget where my wife went. No. When we do such jokes, what happened? The condition gets taken lightly. People don't really understand that what is it like when you lose all the acquired memory that you have learned through your life. It's okay if you're not able to understand, you open the fridge, you don't know what was there in the fridge, what did you come to take it for. It's all right. What happens when you forget who's your wife? What happens? How do you don't know how to use the toilet? It's challenging. So there needs to be more awareness. There is dearth of services. There aren't enough memory clinics who can actually provide services. There aren't enough daycare. One of the saddest thing you can do for a person with dementia is to diagnose them and leave them without any pathway for care. It's better not to diagnose, because if you diagnose somebody and you say you have dementia, this is what is going to happen to you, but you know what? I don't have a solution on where you should go. And currently in India, most of the care services are ideally in South. If you go, and that too more in urban, there's nothing much in semi-urban and rural areas. That's the kind of challenge we are talking about. Of course, neurologists, psychiatrists, mental health professionals, there are only few. Other than that, abuse, mistreatment, caregiver distress, burden, availability of service, affordability, these challenges are just numerous that you have to deal with at the ground level. Ideally, if you are diagnosing somebody with dementia, they should be able to have access to memory clinic services. The family should be able to have access to support groups where they can talk to other family members who are going through this condition. They should be able to keep their loved one longer at home by having daycare services which can maintain them in the community. And of course, when nothing helps, residential care services. But are there enough? Absolutely not. So it has pervasive societal consequences. We know that family caregivers are suffering. So tackling dementia definitely requires a national movement, because it's not the problem of elite or semi-urban or rural. We are an aging population. Whole of India, we need solution. So I represent Dementia India Alliance, which is a pan-Indian organization, and our only purpose is how do we bring help and hope to persons with dementia and their family caregivers. So of course, our founding team has a lot of organizations who are working in dementia care across the country. We've got, we are trying to move with all the organizations who are in the space of dementia care, Department of Health and Family Welfare of various states, because whatever as an NGO we can do is going to be limited unless government steps in and does it at a larger scale, right? And we have different kinds of services that we provide, all of them mostly free, information or training or awareness. We go out and tell people, just call us for awareness program. That's the first win that we will have. That itself is challenging. When you want to do awareness about dementia, that's in the last of the cadre. You may want to have awareness on cardiac health and stuff like that. This is a real challenge. Right? So why dementia care advocacy? When we say awareness to action, it's action that all of us can take as community, as people, as service providers, as healthcare professionals, as NGOs, as hospitals. We all have to collectively tackle this problem. Government by itself has many other problems to take care of. Aged care is not in their purview. Dementia care is even more last. So we, all of us, have to take cognizance of the situation, and how do we really work towards it? So we know that the numbers of people with dementia is high. There are very few people working in this space. So the support of the government is very, very imperative. So we know that WHO said that all countries should come with a country plan for dementia. But in India, not much progress has been made in terms of country plan. So we tried speaking to the government and trying to find out why something has not been done. And when we went to the central government, we were told health is a state subject. Please go and talk to the state government. So we came back and we decided, okay, let's talk to the state government. We did that in Karnataka with the help of NIMHANS. We went and spoke to the state government. And through our efforts, we were able to get the health minister to announce dementia as a public health priority. Right? When it was announced in 2023 as a public health priority, they put together a team to actually work on a dementia action plan. So when the action plan came up, it's about awareness across the districts of Karnataka, not just healthcare professionals, all stakeholders who are involved in dementia care, risk education, how do we involve screening into the current non-communicable disease screening that is happening so that we can pick up dementia in the community, support for people, not just at the primary healthcare level where the diagnosis is made, but also at the secondary and tertiary healthcare level so that they can get access to medication, they can get access to training, and as well as how we can use teleconsultation platform because of lack of neurologists and psychiatrists in this field. And we also looked at how we can actually involve research. Isaac very clearly said that you need to have database of people who have dementia to really, really say to the government that the problem is huge. Because when you go to the government hospital, diagnosis of dementia doesn't happen because the people with dementia do not come to the hospital at the primary and secondary healthcare level. So that needs to be improved. And we were able to do this in Karnataka, and we are hoping that in next few years, we are able to take it to a few other cities. I think Dr. Alex is also here. With his support, one of the things we were able to do is to speak with NABH and bring in dementia-friendly hospital checklist as part of NABH accreditation process. We know that in hospital, most of the patients are elderly. They would have gone for a hip fracture, diabetes, and all of other condition. Many of them would have cognitive impairment. We are talking about 7.4% of people above the age of 60 having cognitive impairment. That gets missed at the hospital because hospitals are not equipped enough to identify cognitive impairment. We are hoping through this checklist, we are able to get the hospitals staff to be more aware of identifying cognitive conditions so that we are able to do early diagnosis, also provide continuity of care. So in terms of way forward, we are able to do it in one state. We recently met the health minister of Andhra Pradesh, and he has agreed to actually get onto the bus and announce dementia as a healthcare priority in Andhra Pradesh. We are hoping that would be the second success, at least 2 states to go to the central government and say, look, we have done, can you do something at the central level? And we are hoping at someday, perhaps, being very optimistic, by 2028, we are hoping that there will be a country plan, some sort of a draft that is there to address the large dementia epidemic. As I said, each of you, as community people, as public, as healthcare professionals, as service provider, all of us can actually play our part in bringing dementia care to the forefront. Each one, teach one, more people get to know about it, and that's the first win that we are talking about. And thank you very much for the opportunity.